The next skill that I'm going to perform is to perform in assisting with a bedpan. First is introduce your name and identify the patient. Hi ma'am, I'm Hardy Gama Jr. I am student nurse and you are. Then after that is provide client privacy by closing the door and by closing the curtain. The next step is you need to explain the procedure. So explain what are you going to do and why it is necessary. Then position the patient properly. So by using the bed controller, position in a flat position the patient. And the next step is gather the supplies that need into the procedure. So we have a clean gloves, we have a trash bag, we have a bedpan, we have a tissue, we have a washcloth, we have a waterproof barrier, and we have a also the what we call washcloth. And next step is we need to perform hand washing. After perform hand washing, apply clean gloves. Then the next step is first place the bath blanket to help the patient uh, stay warm and to for additional privacy. And the next step is you need to pull the cover up, so exposing only the lower part of the patient or the body of the patient. The next is you need to bend the knees of the patient and put the feet flat on the bed. Then after that is you need to use the waterproof blanket. So you need to use the waterproof blanket. Then place this under the hip of the patient. So you need to ask the patient raise the hip, or if the patient is not raise the, if not raise the his or her hip, you also raise his or her hip. Then place the waterproof blanket. Then I'll do the same this into the bedpan. So place underneath back of the patient. Then after that, cover the patient down. Then give the paper tissue or the wipes that use of the patient. Then the call light if the patient is if done. So then after that is you need to position or raise the patient head by using the bed controller in a comfortable position. Then after that perform hand washing. So first you need to remove the gloves and dispose into the receptacle. Then after a few minutes, so you need to go back to the patient room, so check if he or she is done. Then you need to ask if he or she is done, so you need to perform hand washing first. Then apply clean gloves. So after applying clean gloves, so first you need to do is to remove the paper tissue. Then position the patient properly. So by using the bed controller, lower the bed in a flat position. Then after that, pull the cover up to expose only the lower part of the body. Then after that, bend the knees of the patient. Bend the knees of the patient. Then after bend the knees of the patient, you need to use the trash bag. So you need to use the trash bag to remove the bedpan. Then I will take my washcloth to clean or wash the genital area of the patient. Clean the wash or genital area and rectal area of the patient. So first I will turn the patient into the other side or one side. So I will turn the patient to one side. Then wash the perineum of the patient. So from front to the back of the body. Then after that, dispose into the receptacle. Then position the patient. Then return back or cover back the patient. Then I put the bedpan into the bathroom. First, I will remove the trash bag, then put into the receptacle. Then after that, I will empty the contents of the bedpan into the toilet. Then after emptying into the toilet, next step is you need to clean and sanitize the bedpan. So after clean and sanitize the bedpan, you need to place the bedpan into the storage cabinet. Then after that, you need to remove the gloves. So after remove the gloves, the next step is you need to reposition the patient by using the bed controller. So position the patient into the comfortable position. Then after position the patient, next step is you need to remove the bath blanket. Then place this bath blanket in a appropriate receptacle. Then after remove the blanket, the next step is you need to clean the rest of the supplies. Then after clean the rest of the supplies, you need to wash your hands. Then after wash your hands, the next step is you need to report or record. Thank you.